If you love to stay active, whether it's running, hiking, you name it, there's pretty much nothing more maddening than that one pain that just will not go away. You know the one. It's that spot that holds you back, turning something you love into a source of stress. Well, today, we're going to dive into two of the most common culprits behind that nagging pain.
So, think about it for a second. Does this sound familiar to you? Maybe it's that really sharp pain on the outside of your hip, the one that makes it impossible to lie on your side at night. Or maybe it's that dull, achy feeling right in the front of your kneecap that pops up every single time you go down the stairs. If you're nodding your head right now, trust me, you are not alone.
Okay, so let's actually put a name to these pains, because they aren't just random aches and they're not just in your head. These are specific, well-researched medical conditions.
That side hip pain we mentioned, that's typically Greater Trochanteric Pain Syndrome, or GTPS for short. This one usually shows up in adults, we're talking 40s to 60s, and it's way more common in women, like 2 to 3 times more. Now that front knee pain, that's Patellofemoral Pain Syndrome, or PFPS. And here's the wild part, while the hip pain is common later in life, this knee pain is incredibly common in teenagers. It actually peaks at age 13 and affects almost a third of all adolescents. Totally different groups of people, right?
So, we've got two different problems affecting two very different age groups. But what if I told you the real reason behind the pain is pretty much the same for both? It turns out where you feel the pain is often just a symptom of a much bigger issue.
Here's the best way to think about it. The pain in your hip or your knee, it's like a tire on your car that's wearing out unevenly. Now, you could just keep patching up that tire, but it's just going to wear out again, right? Because the problem isn't the tire. It's the car's alignment. And it's the same with your body. The real problem isn't just the joint that hurts, it's the whole system that's out of whack.
At their core, both of these are overuse injuries. For the hip, for GPTS, it's usually caused by repetitive friction in tiny bits of damage, microtrauma, to the tendons. For the knee, with PFPS, it's often because of muscle imbalances. Maybe your quads or hip muscles are a little weak, which makes your kneecap track the wrong way. In both scenarios, the system is being stressed over and over again. And that pain is just the alarm bell screaming that something's got to change.
So the million-dollar question is, how do we fix the alignment and not just patch the tire? The great news is that the research gives us a really clear, evidence-based playbook. And this isn't just a list of things to try, it's a step-by-step strategy. So let's walk through this. Think of it like a ladder. You start on the bottom rung, which is the absolute foundation, physiotherapy. Then, for a short-term boost, you might climb up to injections. Above that, you have some new and emerging tools, and way up at the top, as a final option, there's surgery. The key is, you really have to climb these rungs in order.
Let me be absolutely crystal clear on this. Physiotherapy, which is really just a mix of education and specific exercises, is the single most important step. For both hip and knee pain, the research calls this the gold standard. Why? Because it's the only thing that actually fixes the underlying alignment problem for the long haul.
And if you need some proof, just look at this number. In one of the key studies on that hip pain GTPS, a massive 60.5% of patients who just did a guided home exercise program said their symptoms were completely gone after 15 months. That is the power of doing the work consistently. It's not a quick fix, no, but it's a real one. Okay, so where do things like corticosteroid injections fit into this? Well, they're a fantastic short-term tool. In the first 3 months, yeah, they can be super effective for knocking down that acute pain, but their real purpose is to calm everything down enough so you can actually do your physiotherapy. Because look, after a year, the evidence shows there's basically no difference between people who got the shot and those who just stuck with PT. An injection is a bridge, it's not the destination. Now, let's talk about those emerging tools. One of the really promising ones is called extracorporeal shockwave therapy, or ESWT. It's totally non-invasive. It just uses these high-energy sound waves, think of them like tiny pulses, to kickstart healing in the tissue. In one really good study on hip pain, patients who got shockwave therapy saw a 68% improvement, which was nearly double the improvement of the control group. So it's a really powerful option if PT alone is going a bit slow.
And finally, what about surgery? This is the absolute last resort. It's reserved for those really stubborn, debilitating cases where you've identified a clear structural problem, like a major tendon tear. But when it's necessary, the results can be life-changing. I mean, look at this. Some procedures can take pain scores from a 5 all the way down to nearly 0.
But you know, fixing the mechanics, the alignment, isn't always the whole story. The latest research is showing us loud and clear that when it comes to chronic pain, we have to look beyond the joint and think about the incredibly powerful connection between our mind and our body. This quote from a knee pain study says it all. Things like anxiety, and especially a fear of the pain itself, sometimes called kinesiophobia, can actually make the pain worse and make it harder to function. It's a vicious cycle, right? The pain makes you afraid to move, but that fear of moving stops you from doing the exact exercises that would help you heal. Your brain is trying to protect you, but it actually ends up trapping you.
And check this out. Here's another piece of the puzzle you probably wouldn't expect: your nutrition. A study looking at those teens with knee pain found that a shocking 71% of them were either insufficient or deficient in vitamin D. Now, that doesn't prove that low vitamin D causes the pain, but it's a critical nutrient for muscle and bone health. A correlation that strong suggests it's another piece of this whole systemic issue that we just can't ignore.
All right, we have covered a ton of ground here, from what these conditions are to a full treatment plan, and even the mind-body connection. So, what do you do with all this? Let's boil it all down into a clear, simple action plan. Here it is, your 4-step action plan. Number 1, identify the pattern. Get a sense of what you might be dealing with. Number 2, and this is the big one, start with the foundation. Find a good physical therapist and really commit to the exercises. 3, treat the whole system. Think about your stress, your mental state, your nutrition. And finally, number 4, use all this information to have a really smart, informed conversation with your doctor about what the best path is for you.
Ultimately, it really helps to change how we think about pain. It's not just an enemy we need to crush. Pain is a message. It's your body's way of telling you that something, somewhere in the system, is out of balance. So the real question isn't just how do I stop the pain? The real question is, what is my body trying to tell me?